So, my mate is a 50-year-old bloke who's been driving trucks for years, and, well, he's been having a rough time with his gut. He's got diarrhea sometimes, then constipation, and, every now and then he notices a bit of bleeding when he goes to the loo. Honestly, his diet's not great. He knows he's overweight, and a while back the doc told him he was pre-diabetic. He smokes a fair bit, and, drinks quite a bit on the weekends too. He reckons it might just be hemorrhoids, but yeah, he's pretty embarrassed about it and doesn't really want the doctor poking around down there. All he really wants is some cream to sort out the hemorrhoids. He's thinking about booking in to see a GP, but he's worried. Life's busy. He doesn't want to mess around with tests or make it into a big deal. He's also wondering, how long he'll have to wait for an appointment, what'll actually happen when he gets there, and, yeah, how much it's all gonna cost.
When booking a GP appointment in Australia, wait times to see a doctor typically range from a few days to a week, but this can vary depending on the clinic and location. Many clinics offer online booking systems, which can help secure an earlier appointment. Walk-in appointments may be available at some clinics but can result in longer waiting times. At the appointment, the GP will ask about your symptoms and medical history and may discuss any relevant lifestyle factors. They might recommend treatments like creams for hemorrhoids or suggest further investigations if there are concerns such as bleeding or changes in bowel habits. Physical examinations are usually part of the assessment, but the doctor will explain why the examination is needed and seek your consent before proceeding. If you are uncomfortable with an examination, it is important to communicate this, and the doctor will work with you to manage your care accordingly. Most standard GP appointments last around 10 to 15 minutes. Waiting room times can vary, but typically range from 20 minutes to an hour, depending on how busy the clinic is at the time. Regarding cost, if the clinic bulk bills, the appointment will be free of charge with no out-of-pocket cost to you. If the clinic does not bulk bill, you will pay a fee, usually between $50 to $80, with Medicare providing a rebate that reduces the overall cost. After-hours or weekend appointments may have higher fees. To make the most of the appointment, it can help to prepare notes about your symptoms and any questions you want to ask. Remember, your GP is there to help and handle sensitive issues professionally and respectfully. This general information aims to provide an overview of what to expect when seeing a GP for issues like hemorrhoids or other health concerns. Your experience may vary slightly depending on the clinic and your specific situation.
This is a summary of research evidence to date. Hemorrhoids can often mask the symptoms of colorectal cancer in men, leading to delays in diagnosis. Research has shown that men diagnosed with colorectal cancer frequently had hemorrhoid-related treatments or prescriptions up to 18 months prior to their cancer diagnosis, suggesting that symptoms attributed to hemorrhoids may actually be early signs of cancer. Additionally, people with hemorrhoids have been found to have a higher risk of developing colorectal cancer, and patients presenting with rectal bleeding and hemorrhoids often have coincidental colorectal cancer, especially in older individuals. These findings highlight the importance of thorough medical evaluation, including colonoscopy, to rule out colorectal cancer when rectal bleeding occurs, even if hemorrhoids are present. This issue is particularly pronounced in men due to several factors. Men tend to misattribute symptoms like rectal bleeding to hemorrhoids, causing delays in seeking medical help due to embarrassment or fear of a cancer diagnosis. They also generally have lower rates of healthcare utilization and are less likely to undergo timely diagnostic procedures such as colonoscopy. Furthermore, general practitioners may have lower suspicion for colorectal cancer in younger patients or may inconsistently document risk factors, causing missed diagnostic opportunities. Overall, the misinterpretation of symptoms, reluctance to seek help, and delays in diagnostic activity make hemorrhoids a significant decoy that can lead to late diagnosis of bowel cancer in men, emphasizing the need for increased awareness and timely investigation.